So today we're going to discuss something called atelectasis, which is actually collapsing of the lower parts of the lungs, peripheral airways. They can become clogged with mucus or just from underexpansion. If you have a low vital capacity, basically anybody with less than 50% of a vital capacity reading is possibly going to develop atelectasis. So we're going to show how we can prevent that and also reverse it if it is becoming a problem. So by measuring the vital capacity, breathing capacity, simply with a handheld spirometer. So I'm going to ask my patient to take a deep breath, and she's going to blow that needle around. Now, okay, that's pretty good. I'll say it was 2 liters, which might be about 50% of predicted. So what happens is we have a lot of reserve in the lung, and we use that reserve when we're active, when we're exerting ourselves, running, playing, whatever. So we need that there, and most of us do some activity that keeps that reserve area expanded. But patients who are weak and cannot take a full deep breath, the reserve area of the lung is going to be underexpanded and begin to collapse in time. So the way we can remedy that is by inflating the lungs, and that can be done very simply. If this is their only problem, this is all the patient might need, is a simple, this is called an ambu bag or a manual resuscitator. And one squeeze is roughly 1 liter of air. So if I know the patient has only 2 liters of breathing capacity, but they are predicted as a normal to be 4 or 5 liters, then I can supplement and fill out the rest of the lung with successive squeezes from this bag. So if she can take 2 liters of air, so you'll take your breath in and hold, and then I'm going to add additional air. So I'm squeezing air in, she's getting bigger, so she's holding that next breath, and then another breath will be added, and then we can measure that with the spirometer here. So now you blow it out, complete out, all the way out. So I'm looking for a number that's bigger than her vital capacity. So here we went up to, wow, 5.5 liters total. Okay, so we completely filled the lungs up. Now, someone who has been breathing shallow for a long period of time, they may not reach very much difference on the first attempt. I might be able to put in maybe 500 cc's or maybe only 1 liter of air. But over time, if they practice this, and we recommend that it's done 3 times a day, and to hold the maximum, you may cough, you may have a little discomfort, but you can do it gradually, and as you do it more, usually that number will grow. We call this the MIC, or the maximum insufflation capacity. And this is something that we measure on a regular basis. Okay? So now, if someone is using a device, a ventilator, let's say, with a mouthpiece, then they can use their ventilator to do the same thing, because this is a manual ventilator. So you can use a portable ventilator to air stack, but it has to be in a volume setting. You cannot air stack with pressure settings, because once you reach the set pressure, the next breath is only going to be at the same pressure, and therefore no additional air will be put into the lungs. But with volume set, which this is a volume device, I'm pumping a breath of air, I'm holding it, I'm holding another one, and as much as I can hold to fully fill out the lungs. That keeps the lungs flexible. It prevents atelectasis or collapsing of the small parts of the lung from happening, and keeps the person healthy. And if you get sick, you'll get much better results from the device such as the cough assist to clear the lungs, because your lungs are flexible and fully expanded. Okay, people who are not able to coordinate the air stacking, then we usually would recommend that they use the cough assist, set at 50 to 60 centimeters of water pressure to give a nice deep breath, and that'll also prevent and reverse atelectasis. Okay.